Now today we will see how to cannulate a right internal jugular vein, and for this first of all we need to have a proper positioning of the patient. So here you can see the patient is lying supine, and we also see that the head is lowered so that we have a positive pressure inside the IJV, and at the same time we see to it that the head of the patient is turned to the opposite side from where we want to insert the line. So as in case you can see that we are intending to get a right IJV, and that is where the head of the patient would be turned towards the left side. Now further we need to see the landmarks. So let us see the landmarks. This is the suprasternal notch. Here you can see the clavicle, and apart from this you are supposed to see for the sternocleidomastoid muscle. So this is the muscle which is having two heads on the caudal side, and as it goes cephalic it goes towards the mastoid process. So where the two heads join, the sternal and the clavicular head of the sternocleidomastoid muscle join, at this point it creates actually there's a triangle. So at the apex of the triangle you will be able to palpate the internal carotid artery, and just lateral to the internal carotid artery will be a point where you will be able to get the IJV. So these are the landmarks. Now after identification of the landmarks and getting the proper position, now it's time for us to clean the area. So now we are using one of the antiseptic solutions to clean the area. It is very important for us to clean the area well, because under the notion to put a line, we should not be introducing any further infection, and in that case we'll be doing more harm to the patient than doing good. Yeah. Now after we have cleaned the area, it is time for us to drape the area, and here we want only the part in concern should be exposed, otherwise rest of the area should be covered, so that again we minimize the chances of infection. So this is the area of concern. Here you can see the landmarks, two heads of sternocleidomastoid muscle, clavicle, and this is the triangle which you can see, which is formed below by the clavicle and the sternum, and as the two heads come up it forms the apex of the triangle. So this is the concern area which is now exposed, and rest of the area is draped. Now after draping the area, what we do is we anesthetize the place from where we will be inserting our needles. So just at the apex we anesthetize the area using local anesthetic agent. What we usually use एक सुई लागेल काका. What we usually use is 2% lignocaine, preservative free. Kaka हो गया 2 minute. We need to console the patient. At the same time you are inserting the local anesthetic agent, and you need to see that you should go to the proper planes. At the same time you should need to see that you are not injecting the solution into any of the vascular components. This is how we anesthetize. After we anesthetize the area, we have given almost 2 minutes for the local anesthetic to act, and now at the apex of the triangle we are palpating the carotid artery, and we're just trying to go lateral to the artery so that we'll be getting a puncture for IJV. So let us proceed. So here we are in the IJV, which can be seen by the blood coming down. So this is how we get a puncture and get the blood inside the syringe once you are in the artery. So now in the same direction we'll be moving with the help of this actual needle, which is a much broader gauge needle, in the same direction of the guide needle. This is how we get a puncture for IJV. And now, keeping the needle steady, we'll just be putting a guide wire through this needle. And and we see to it that it is pushed sufficiently well inside the needle so that it goes beyond the tip of the needle and lies in the IJV. So once the guide wire is in, now we slowly remove the guide needle and we slowly remove the main needle as well, keeping in mind that you're not supposed to pull the catheter along with the needle. Here we come out with the needle. Here you can see the entry side. Now the needles are out and only the catheter can be seen. Oh, sorry, guide wire can be seen. And now what we do is we just try to give a small nick at the side, the port of entry of the guide wire, so that we'll be able to push the dilator. Now this is the dilator actually, which we will be threading with the guide wire, so that we'll be able to dilate all the tract, and it will be easy for us to put the catheter over this. This is how we dilate the tract. Now before pulling this dilator out, we need to see that we give a firm pressure over the port of entry, because once you pull this dilator out, there can be a chance of torrential bleed. So with the pressure on the entry port, I am just pulling out the dilator over the guide wire. At this point, you also need to see that if in case your guide wire is too much inside the IJV and going towards the right atrium, then there may be chances of arrhythmias. So at this point, you also need to keep a check on your ECG tracings. And now we have already dilated this. It's time for us to thread the catheter, IJV catheter, over the guide wire. One thing at this point is very important, and that is you should never be putting the guide wire you should never be putting the catheter beyond the entry port unless and until you do not get the guide wire coming out of one of your ports. So now you can see the guide wire has come out one of the ports, and then now you can easily thread the catheter over the guide wire. Here comes guide wire out. At this time, you need to keep this catheter king, because at this point the air may get inside and may lead to air embolism. Now we apply the cap. We'll just make the area a bit clean. And now it's time for us to see whether our catheter is really inside the IJV or not. And how do we do that? We do it by trying to aspirate the blood. So let us go towards the yellow port now. This is how we fix the needle and try to aspirate the blood. Now you can see the blood is freely flowing through the catheter into the syringe, indicating that our catheter is well in the IJV. We flush it. It's very important for us to flush it properly, otherwise the blood will get brought into the lumen. This is how we confirm the placement of the IJV. Again, the second port, the same thing we do, we just try to aspirate, see the free flow of the blood, and then we flush it properly, making sure that the entire catheter is flushed properly so that none of the blood is clogged inside either of the lumens. So this is how we place the IJV catheter inside an intrajugular vein. And after placement of the catheter, we need to connect it to the IV line like this, and at the same time we need to check the backflows. So now after connecting this, I have opened this valve and I'll see for the backflow. नीचे कीजिए इसको. And now you can see once the IV connected IV is lowered, the blood is coming through this catheter ऊपर कर लीजिए. So this signifies that probably the catheter is well inside the IJV, and at the same time free flow is also to be checked. If in case it would have been in the artery, then probably there wouldn't have been a free flow from the IV bottle to the cannula. Now after confirming the free flow and the back flow, we are very much confirmed that our central venous pressure line is inside the IJV. So now it's time for us to secure. So now the thing which we used for the securing the line to the skin is 30 Marshall reverse cutting, and you can see this is how we take stitches to secure our cannula to the skin. Another fact you can appreciate is that patient is not yelling with pain, because whatever we have used as a local anesthetic has acted very effectively. So that is that the patient is too calm and is allowing us to do the procedures very calmly. So this is how we secure our cannula to the skin. Now once we have secured the IJV cannula to the skin with the help of these Marshall reverse cutting 30 sutures, it's time for us to go for dressing. So what we prefer is the translucent dressing. So this is how we place the dressing over here. The advantage of the dressing is we'll be able to see for the port of entry of the cannula. So if at all there is some inflammation or some pus collection, it can very well be seen through this transparent dressing. So this is how we apply the transparent dressing. So here it completes the entire procedure for putting the cannula in the right IJV. As per the protocol, any line inserted should be followed by a check X-ray. So here also you can see that we have had gone for a check X-ray post line, and you can see the CVP line which we have just inserted lies just on the right side of the sternum, and probably it is just at the junction of superior vena cava with the right atrium. Also you can see that there is absence of any pneumothorax, which is one of the most likely complications of this procedure.